are back once again talking about cardiothoracic surgery, and I appreciate your time. You brought a model which I think is really interesting, and we are going to do some B-roll later, and so we can really show some things that we've been talking about. But I think one of the things that you wanted to do is demonstrate exactly what you're doing with bypass surgery.
Yes, ma'am.
And that would be a you thing.
Yeah, we can take this right here. So these parts here kind of describe what we do in bypass surgery. So there's two portions of it. One is attached to the artery that requires the bypass, and that
what
would
is
be
this?
This would be what we describe as conduit, and it can either be artery or it can be vein. That's the material that we need to provide the new blood flow, and it's a pipe, so to speak.
Okay, got it.
And so there has to be two components to that. One part is the part that you sew onto the surface of the heart past the area of the blockage, so it provides new blood flow to the muscle of the heart, the
So
myocardium.
where would my blockage be, for instance? Here?
Yes, it would be up here in the artery portion. It would be, sometimes it's proximal, like just a single bump in the road, like a speed bump. Sometimes it's very lumpy, bumpy, like you're going down a rocky road.
Okay.
And that has more to do, sometimes if you have long-standing diabetes, sometimes it's more diffuse in nature.
Got it.
Rather than just a discrete spot. But we always sew the bypass past the area of the blockage. And then what I like to say you have to have an inflow. And so the other side of the bypass, it doesn't do any good to go and put a garden hose there at the plant that you're going to water if you don't stick the other end of the garden hose to the supply line,
Makes
the
sense.
spigot on the house.
Yes.
So the other portion of it, for a vein bypass specifically, would be sewn to the aorta. Yes, ma'am.
So let's talk. We've had our bypass surgery. I've been in the hospital 4 days. I'm excited to get out. I'm feeling pretty good. What can I expect from a recovery point of view? And then how often do I come back with you? Do we check in together pretty regularly for a while?
Yeah, so everyone's evaluated on an individual basis. So depending on what you need whenever you go home, that's kind of specific to you.
Okay.
Usually there's 3 levels that we kind of look at. One would be a short inpatient rehab stay if they need a little bit more help, or maybe they don't have as much help at home.
And would rehab be, am I looking at activities of daily living? What kinds of things are we looking to?
Yeah, getting up, walking, moving,
toileting, everything like that.
Physical therapy,
Okay.
occupational therapy.
Okay, got it, okay.
The second is going home with home health, where a nurse comes out and visits with you to do the same thing, physical therapy, occupational therapy. And then the third is just to go home without.
Do you put together a treatment or intervention plan? Treatment plan really is what it would be, where there's cardiac rehab involved. You want me to get back to doing my activities, maybe get strong again. How does all that work?
Every single patient we see gets one of those.
From
the start to the end. Yeah, we try to talk about it as we go along, and it kind of changes sometimes, and we deal with it as it comes up, but yeah.
And so, do I come back and visit you? Once I have this bypass, what then happens? What then is protocol?
Typically, you'll come back to see us. The patients will come back a week or 10 days after being discharged, if they don't go to an inpatient rehab setting. And if everything looks good, the wounds are healing well, and they're progressing as we expect, we give them then an open appointment, meaning they call us, we can get them in. If we can handle it by phone, we'll handle it by phone.
If I have had this kind of surgery, am I more likely or predisposed to other coronary artery disease? I mean, obviously now I'm in the system, right?
Right.
So I have my cardiologist, or you all are also watching out for me. Is that how?
Actually, our workup for patients before surgery is indicative of other possible risks they can present with.
Okay.
We look at their carotids to make sure they don't have blockages there. We look at their kidneys.
Oh, interesting.
Sometimes we look a little bit more in depth at their arteries
Like
to their
femoral,
legs.
okay.
Exactly. And we do several different things on different levels. Breathing.
Got
We
it.
look at their lungs.
Got it.
And but all those things, you're absolutely right. When you have coronary artery occlusive disease, you have to suspect other organ system dysfunction.
I'll tell you, this has been 3 segments, and every segment I felt like I have learned so much. I think that our audience is going to be really grateful for the opportunity to learn from you. You've explained things in a way that's demystified it. It's not so scary now. It really feels manageable, if you will. So I appreciate your time. Thank you. Thank all of you for joining us here on Healthy Living. Have a safe and wonderful week. Bye-bye.